Rachel, for having us today. As Rachel said, we are with the American Cancer Society, and we're excited for you to join us here today and hoping that we can share some really good information with you that will be useful to you and those that you work with and serve as well. So, next slide, please. So this is the team. Me, Nikki Leak, Associate Director of Cancer Center Partnerships, and Lily Jackson is also joining us today and will be presenting. She's an Associate Director for Cancer Center Partnerships out of St. Louis. Amy Krylacek, also presenting today, Associate Director, Access to Care Solutions Delivery for Missouri, Kansas, and Nebraska. And then Maggie Grodefit, who is Associate Director of State Partnerships for Missouri and Kansas, will also be presenting today. The two that will not be presenting with us today, but I wanted to make sure to give them a shout out, is Jamie Courier, who is the Associate Director for Community Partnerships for St. Louis, Missouri, and KCMO Metro, and then Lindsay Hensley, who is Associate Director for Cancer Center Partnerships for Kansas. Next slide, please. So, to share with you what the American Cancer Society focuses on, our vision is to end cancer as we know it for everyone. Our mission is to improve the lives of people with cancer and their families through advocacy, research, patient support to ensure everybody has the opportunity to prevent, detect, treat, and survive cancer. Next slide, please. So we are going to kick off our presentation with Maggie, and she's going to share information about our wonderful, one of my most favorite services that we provide is our Hope Lodges. Maggie?
All right. Thank you, Nikki. Good afternoon, everyone. So yes, Hope Lodge is, I have to agree with Nikki. It's one of my most favorite programs and services that the American Cancer Society can provide to patients. We know that our patients are getting wonderful treatment all over the state, but from time to time, they do have to come into the city for treatment. And we know that access and transportation can sometimes be a challenge for our patients, as well as price. To have to travel and to stay the night, several nights in a row, can be very costly. We know financial toxicity is an issue with many patients. So Hope Lodges allow our patients to stay at no cost during their treatment times. It's a wonderful place to bond with other patients who are going through the same things. We hear stories of lifelong friendships that occur at our Hope Lodges because they're with people that are going through similar things. Caregivers can bond. So it's a wonderful resource to have. Here in Missouri, we're very unique from the rest of the country in that we actually have two Hope Lodges. We have one in St. Louis and we have one in Kansas City. So we're very blessed that we're within 2 to 4 hours of anywhere in the state for individuals to come and stay the night. So wanted to just show you some of the amenities that Hope Lodge offers. This is pictures of our most newly renovated Hope Lodge in St. Louis. This renovation occurred during lockdown and COVID, so we weren't expecting that to happen, but it did happen a lot quicker. So this happened in 2020. It's a beautiful facility. We have 42 guest rooms, each with a queen and a twin extra large bed, a private bathroom, and a sitting room with a smart TV. It's a very nice space because it gives a little division for the patients and their caregivers, because I'm sure, it's hard going through all of that. Patients might need to rest, caregivers might just need some time to themselves. So it's a great setup for those patients and caregivers. It's a 4-story facility with a first floor fireplace and 4 day rooms with TV. So it's very bright, it's light, it's a happy space. We want to keep people's spirits bright when they're there. There's 8 fully equipped kitchens and a dining room area for up to 80 people. Patio with a gas grill and seating. There is a library, fitness room, reflections room, and a 4th floor balcony, which is absolutely beautiful. It sits outside. You can look over the city. The sunsets are wonderful there, so it's a great place to be. Free on-site parking, which is a great perk in the city. 4 guest computers and 1 guest printer. Wi-Fi internet, and 3 laundry rooms stocked with laundry and cleaning supplies. So we do try to make this an affordable stay for the patients. We provide all the laundry soaps and such. We also have a lot of people come in and do meals and such for our patients. They can go and grocery shop for themselves. They have places that they can keep their meals and their food securely at Hope Lodge. But when we can, we like to have volunteers come in and cook for them to give them a little break. Um, Next slide, please. Oh, okay. We also have a Hope Lodge in Kansas City. Right now, our Hope Lodge in Kansas City is actually being renovated, which is exciting. Saying that though, we are only at 50% capacity. So we are operating on half of our building right now because they're renovating the other half. So we're 100% capacity full right now, but there's still rooms available. Just call ahead to make sure that there's something available for your patients, but they are being renovated currently. They are also a close proximity to their local cancer treatment centers. They have 46 private guest rooms and bathrooms. They have a fully equipped kitchen, community kitchens for food storage and preparation, gathering areas as well as great rooms and community dining rooms, free laundry rooms stocked with supplies, an outdoor reflection and meditation space, a library and a resource rooms, TVs and computer access. And they have a nice outside area with this Hope Lodge as well for people to sit and enjoy the outdoors. So it's a beautiful building. Next one. Okay, so the Hope Lodge room request process. So the medical staff thoroughly has to complete a lodging request form and email it or fax it to our Hope Lodges. Lodging is granted based on availability, treatment start date, and date of request. And please note that a request form is not a guarantee of admission. The Hope Lodge staff contacts all potential guests, patients, and caregiver prior to admission to determine eligibility based on disclosure information. All eligible guests will be admitted as occupancy allows. All guests must have a valid photo ID for admission to Hope Lodge. Some special accommodation requests must be forwarded to the Hope Lodge senior manager, and approval is subject to eligibility assessments per policy. So on occasion, there might be a special accommodation, but you do have to contact them ahead of time. Okay, next slide. And like we said, we are lucky to have 2 Hope Lodges in Missouri. Here's the information to contact those Hope Lodges. We have their website as well as their fax information and phone number. We also are on Facebook, so you can look at the latest and greatest what's going on at those Hope Lodges on Facebook. A lot of our volunteer communities will come out. They'll do projects with our Hope Lodge guests. They'll make meals for them. We're always looking for volunteers to do that. So if it's something that you're interested in, please reach out to us. If you ever want to take a tour of our Hope Lodges as well, please reach out. We'd be happy to give you a tour. I'm local to St. Louis, so happy to meet you at Hope Lodge one day to get a tour. And a couple of our other staff that are not on the call today, they're more local in the Kansas City area, and they'd be happy to meet you and give you a tour as well. And next slide. We have one other Hope Lodge that's within driving distance, and that's Oklahoma. That's one of our newest ones. It just opened, I think, was it last fall, I believe it opened. So it's up and running as well. So we have 3 options within, just a few hundred miles of where we are in Missouri. So we are very lucky. So again, reach out if we can do any tours. We would love to show it off. It's one of our greatest assets. All right. Next, I believe I'm handing it off to Amy.
Yes, I will mention there is a Hope Lodge in Omaha also for those on the western side of Missouri. If they're headed to Omaha, there is a Hope Lodge up there too. It's a fairly new facility, not as new as Oklahoma City, but new. And there are over 30 Hope Lodges across the United States. So if you know of others who have to travel away for their cancer treatment, it's definitely something worth checking into. But where we do not have Hope Lodges, the American Cancer Society does have a partnership with the Extended Stay America properties. Very similar to the Hope Lodge, the patients do have to be traveling for a cancer treatment related appointments. They do need to live more than 40 miles away from the cancer treatment center. They do have to have a permanent address. They must be able to care for their personal needs or travel with someone. And if they're under 18, they definitely need to have an adult with them. In order to book the program, they do have to have a credit card and access to the internet, or someone who can help them access the internet to book with the Extended Stay America properties. We are in the process of renewing our contract with Extended Stay America. We have had some free rooms available in the past. Unfortunately, all of those are gone. And right now, the discount is a 45% discount. So, and it all depends upon whether there is availability at the Extended Stay America property on whether the discounts can be used or not. So all someone needs to do to be eligible for an extended stay America, it's a special link and a special code that they can just get the discount. They just need to call the American Cancer Society. We call it NCIC, which is our National Cancer Information Center. And the number is 1-800-227-2345, and start the inquiry process. They will email them a unique link. That link is good up to 5 consecutive nights, and each individual can receive up to 8 links. So that's 40 nights. So if they do have to stay in a specific area for an extended period of time, those links are up good for up to 8 weeks, which is awesome. And this talks a little bit more about the booking process, but really the biggest part is just have them call the American Cancer Society and we can walk them through the Extended Stay America partnership. And it also works too if the patient doesn't qualify to stay at Hope Lodge, or if there isn't room at the Hope Lodge, they can definitely take advantage of the Extended Stay America partnership. Also, this is a program that I work on, is our Road to Recovery program. This won't be surprising to any of you, but in any given year, 3.6 million Americans miss at least one medical appointment due to lack of transportation. That number is staggering. And of course, the impact of that: delayed or missed medical appointments, difficult making and keeping follow up appointments. Their prescribed health plans have gone out the window because they've missed medical appointments. Increased use of emergency room, and overall poor outcomes. And so that's why the American Cancer Society has the Road to Recovery program. So, Road to Recovery is a volunteer based program that provides rides to and from cancer treatment related medical appointments for patients with cancer who might not have any other way to get there. For the patients to be eligible, they have to be in active cancer treatment. They must be ambulatory, meaning they have to be able to walk unassisted to and from the vehicle and get in and out of the vehicle on their own. Walkers, canes, even wheelchairs are acceptable, but our drivers are not trained to lift patients. So they either need to bring someone with them that can assist them, or they have to be able to do it on their own. They do have to be 18 or older. We don't see very many kids qualify or even need Road to Recovery. They do have to be free of anesthesia and infectious diseases and have a demonstrated need. The rides are curb to curb. So our drivers will pick up the patient on the curb outside of their house and drop them off at the curb of the cancer center. Again, they have to be cancer treatment related appointments. We do require at least a minimum 25-hour advance notice, but the more advance notice, the better. I always suggest if someone is in need of a ride, they should call as soon as they get their appointment schedule. It's easy to rearrange the schedule, but it's easier to get the rides in as soon as we know. Patients can self-refer to the program by, again, calling that same 1-800 number. And again, with COVID, we had a lot of safety precautions, and we still stick with them because cancer patients tend to have weakened immune systems. And so we really do, our drivers wipe down frequently, touch surfaces. They can wear masks if the patients are wanting them to. We take their safety very, very seriously. We can always use more drivers. Drivers must be between the ages of 18 and 84, have a valid driver's license and adequate automobile insurance, have access to a safe, reliable vehicle. They do have to complete a motor vehicle check and a full criminal background check for the safety of everybody. They do have to be comfortable using technology and have internet access. And there are trainings that they have to go through. We do ask that they follow through on the ride commitments that they have accepted. And this is just a slide with a QR code to learn more about the Road to Recovery program and becoming a driver. The Road to Recovery program in Missouri is open in the Kansas City metro area, in Branson, and in the St. Louis metro area and Columbia. So it's open in a lot of areas across the state. So now I think I am giving it back to Nikki.
Yeah. Thank you, Amy. So, a new program, I say new, we've had it for about a year now, is called ACS Cares. And CARE stands for Community Access to Resources, Education, and Support. It's a new patient navigation support program that connects patients, connects caregivers, connects family, friends with quality information and having that one on one support. ACS Cares is done by an app, and we have included the QR code to be able to download the app. But you can also go to the App Store and just put in ACS Cares. I will tell you, I've put this on my phone. And I've played around with it a little bit. It's great because, again, it can be used for patients themselves. It can be used as a caregiver and healthcare system and clinic healthcare providers can also download this. And you actually create a profile for yourself. So you can create a profile as a healthcare provider, as a caregiver, or a patient, and put in specific information, and once that information is loaded, it will pull up a whole entire profile specifically for you. And it's really great. It's information at your fingertips whenever you need it. So I highly encourage if you know anybody that likes to have information at their fingertips, this is a wonderful resource to be able to use to access. Next slide, please. Reach to Recovery. This is a program where we have people who are breast cancer survivors that connect with those who are newly diagnosed. I've always said that you never truly know what somebody goes through when they've been diagnosed with cancer unless you've been there yourself. Things can literally change from day to day, hour to hour, minute to minute, second to second. And when you're able to connect with somebody who has been there and understands, it really helps people through that cancer journey. So, with our Reach to Recovery program, we work very diligently to try to connect those people with like lifestyles. So, a similar type of diagnosis, a similar type of surgery, or some similar type of treatment. If they're married, if they have older children, if they have younger children, if they're single. So we work hard to really connect them with somebody who is very similar to their situation, just so that way they really have that connection and there's that understanding. Again, the QR code is there, but you can also go to reach.cancer.org and then also download the ACS Reach app on the Apple or App Store as well. Another resource that we have is our Cancer Survivors Network. This is essentially, it's an online support group. A lot of people like meeting face to face, enjoy being in the presence of others when it comes to support groups. But there's also times where maybe they just want to be able to connect online. You can do this 24/7, which is one of the things I like about this. You may end up having a question at 2 o'clock in the morning, and you can get online and be able to connect with somebody else or read somebody else's story and just be able to have that questions that you might have or have a similar situation, and you'll be able to connect with others. This is also for caregivers as well, and then even for those who are out of active treatment. It's it's very interesting how you think once treatment is over with, that okay, you move on with a normal life. It's a new normal. So they're able to connect with people who have dealt with cancer previously, and then, of course, questions and different lifestyle changes that they face after treatment. So it's a great way, again, if you've never been there, to be able to connect with somebody who has. So this is a great online service to be available. Again, a QR code at below, but we also have the website as well, csn.cancer.org. Next slide, please. And then our new Ever You. We're really excited about this. You may not be familiar with our TLC magazine, but it has gone through a major revamp. It is a order catalog for people to be able to order wigs, headgear, bras, breast forms, recovery products, just to help people feel better and more like themselves. One of the things about the Ever You catalog is not about, you're not about cancer. Cancer is not you. You are you. And this Ever You magazine provides different different things to be able to make you feel like yourself again when there might be times you don't. And these are items that are available at a lower cost. And the new Ever You is launching this summer. We are right at the cusp of this taking place. We are available online on Ever You, and then the magazines will be available very, very soon. Until then, our TLC magazines are currently available with very similar items available for patients to be able to order. Next slide, please. And Amy had mentioned this earlier in her presentation. Our National Cancer Information Center, or NCIC, as we refer to it. It is our 1-800 number. And then, of course, our information is also available on our website. One of the things I absolutely love about this resource is that it is available 24/7, 365 days a year. You never know when you're going to have questions come up. I have had several people tell me that they can talk to their friends, they can talk to their family, but sometimes they'll just have questions that form, and they just sometimes want an unbiased information, and to be able to get resources that maybe they have questions but don't know what the questions are. So they can call this 1-800 number, and actually talk to a live person, which is fantastic because that's very unusual these days. So if they have questions needing more specific information about their specific type of diagnosis or their treatment, or information about your local resources, national resources, state resources, also clinical trials. We also have a department that handles insurance questions. We have oncology nurses available. So if there's a question that has a more medical base to it, you can ask to speak to one of the oncology nurses. And this is, again, a resource that's available 24/7. And we actually handle about 800,000 requests each year. So this is what I like to refer to as, in a sense, a one-stop shop, because they can also refer to other resources as we put in other organizations that offer support to cancer patients and caregivers within this cancer information line as well. So we try to make it as easy as possible for everyone. Next slide, please. And next is our Empowered to Quit. This is our smoking cessation program. Again, people like different things. Some people like to meet face to face for smoking cessation. We have our Missouri Quit Line, which is also an amazing resource for those who are trying to quit smoking, which is offered through a phone call with a coach. And then we have our Empowered to Quit through the American Cancer Society, which is an email-based cessation program. So I think it's really nice to be able to offer different ways for people to quit that really fits their needs. So if there is anybody that you know that is interested in Empowered to Quit, or you would like to have more information, you can go to cancer.org and type in Empowered to Quit and receive that information. And of course, you can always reach out to us as well. Happy to share the information that we have regarding Empowered to Quit. And then we have our American Cancer Society, CAN, which CAN stands for Cancer Action Network, which is our advocacy department. We work within our state governments to improve the quality of life and the lives of cancer patients and caregivers. We're very fortunate to be able to visit the Capitol once a year in Missouri and other states as well, where we're able to talk to our representatives and our legislators about our priorities for our state and be able to speak with them one on one and share why we feel these items are important. Again, it's about improving the quality of life for our cancer patients and their families. We have amazing ACS staff for ACS CAN. Missouri is Tim Freeman. He's out of Columbia, which is very convenient. And then we have Christina Cowart, who's in Kansas. And they are both truly amazing. We also need volunteers for ACS CAN. So if politics are your thing, and reaching out to representatives and again improving the quality of life of cancer patients, if this is something you're interested in, you can go to our fightcancer.org website to learn more about it and also learn more about our priorities in different states as well as Missouri. And we're happy to answer any questions you have regarding ACS CAN as well. Next slide. Okay, I have the pleasure of handing the next part of our presentation over to Lily.
Hi, good afternoon, everyone. Thank you, Nikki. Um, Today I'm going to talk to you all about Voices of Black Women, which is American Cancer Society new longitudinal study where we are looking to better understand why Black women face higher mortality rates, low survival rates, and low incidence rates low incidence rates, excuse me, when it comes to cancer. Next slide, please. This slide, I want to talk about just the health disparities among Black Americans. American Cancer Society recognized that the health disparities between Black and white Americans, both in the areas of cancer and mortality, as well as other health conditions that's described on this slide. Collectively, Black individuals have the highest death rate and shortest survival rates than any other racial ethnic group in the U.S. And we're looking to find out what's the reason that largely drive those social mechanisms. So with Voices, we again seek to better understand why Black women in the U.S. have worse health outcomes than others. Next slide, please. We're looking to better understand what's driving the health disparities. In the U.S., we look at just focusing on different health disparities and then those factors. With this study, we're looking at the environmental, behavioral, social, clinical, cultural, psychological, as well as biological and genetic factors to better understand with those combinations of factors why those health disparities are there, one, but then also understand how we can eliminate them. Next slide, please. The path to engaging 100,000 voices of Black women, as I mentioned, the study launched May 6th, and we have 20 enrollment states that includes the District of Columbia. We're looking to recruit Black women between the ages of 25 and 55 with no skin cancer except basal and squamous skin cancer and reside in one of those 20 states. Those states were selected based off of Census Bureau data that states that 90% of Black women live in one of those 20 states. Next slide, please. Oops. Next slide, please. Did I freeze? Okay, thank you. So, I'm sorry. I'm back to the content. It didn't advance for me. My apologies. So, the survey will cover different health content. So we're looking at the demographics, ancestry, insurance, and how that plays a role, just the healthcare system as a whole, the type of cancer screenings that's available, medical conditions and medication, different vitamin supplements that Black women may take, family history, reproductive health, as well as their occupation. When we're looking at the behavior and lifestyle information, we're looking at alcohol and tobacco use, the diet and the environment, as well as just access to healthy foods, physical activity, the built environment, sleep and fatigue, anthropometrics, as well as personal care products that's utilized. And the new components that's added from voices that hasn't been researched a lot is the mental health, quality of life, stress, social support and social interactions, education, income, generational wealth, caregiving, and racism and discrimination. Next slide, please. The survey eligibility, as far as enrollment, we have an eligibility survey that'll take about 5 minutes because we want to make sure that anyone that's willing to participate, one, meets the study criteria. So that takes about 5 minutes. And from there, you have informed consent, which will take about 20 minutes. And it's just to ensure that the participants understand what they are involving themselves in. Then you have your registration, which should take about 10 to 15 minutes, the life and health history survey, and that can take 60 to 90 minutes. And then you participants will receive semi-annual survey follow-ups. And with those different components of the survey, as a participant myself, you can step away and you don't have to take the survey at once. ACS systems provide automatic reminders just to make sure that the participant complete the survey, and there are ways for people to ask questions. With this study, it's truly listening to the voice of the women. There's no vaccines, medications, no blood draws, truly surveys to better understand why those disparities exist and how we can help to eliminate them. Next slide, please. So how can you get involved? If you're eligible, you can join the study. If you're not eligible, you can share voices of Black women with your networks, or if you're eligible or not, but you can also discuss engagement opportunities with your ACS contact. I know a lot of you all work with Nikki, but Nikki can always defer people to the team if you have any questions. Also, we have an ambassador program where we focus on recruiting pillars of the community just to be able to help us recruit, share the word about voices, and get the message out to their networks and partners. And if you want to learn more about Voices, I know Amy just dropped it in the chat, but you can go to voices.cancer.org. And if you all have questions, I'm available to answer any of them.